So now for the next artery before us, we're talking about an artery that is actually found down in the lower limb, around the femur. Also, that this is what is known as a lateral circumflex femoral artery. Lateral circumflex. Of course, once you say circumflex, it's an artery that is what? Going around something. You can see that is a branch and it's going around the femur bone. The femur bone now, this place is a place that inserts to give you your hip joints. Do you understand? So the hip joint and the knee joint, of course, they are the most important joints in your leg. Yes, you know. So it's actually what runs laterally across the thigh, divides into ascending, transverse, descending branches that they supply the hip joints, they supply the head of the femur, okay, and muscles that are around that. So that arises from the profunda femoris artery. This is what the profunda femoris artery, and it gives up the branch. So we're just talking about one of the branches, the lateral circumflex. We have the medial circumflex. We'll talk about in the next video. Okay, so causes. It passes laterally across the thigh, deep to the sartorius and the rectus femoris muscles. It travels between the branch of the femoral nerve, divides into three main branches. So for the branches, we have the ascending branch, which runs upward towards the hip joint, anastomosis, the superior gluteal artery, supplies a greater trochanter in the hip joint capsule. The transverse branch, lateral across the thigh, contributes to the cruciate anastomosis, then supplies blood around the hip. So descending branches around the vastus lateralis, down is around the knee. Okay, so that's what we got. So it supplies the hip joint and the femoral head, supplies the anterior and the lateral thigh muscles, supply the knee region via the descending branch, and it contributes to the rich blood supply around the knee and the hip. So learn about the anatomy of this artery, because we want to know about the collateral circulation, we want to know about its relevance in hip surgeries. Of course, you are doing hip surgeries, you have to go have a good anatomy of this artery. We want to know about it because it's important in sport medicines, and also it being a surgical landmark.